Thank you everyone for joining us this afternoon. My name is Lauren Levy and I'm the Senior Coordinator of Alumni Engagement Events with the Office of Alumni Relations. I am very excited to introduce our moderator today, Dr. Jacqueline Smith-Mason. Dr. Jacqueline Smith-Mason is the Interim Dean of the Honors College and a double alumna of the VCU Wilder School of Government and Public Affairs. Her research interests include the impact of public policy on children and families, particularly those affected by mass incarceration. Prior to joining VCU, she spent several years working for the Virginia Criminal Sentencing Commission and the Department of Criminal Justice Services. Thank you, Dr. Smith-Mason, for joining us today, and I'll let you introduce our panelists.
All right, thank you so much, Lauren, for that introduction, and I'm excited to introduce our panelists. First, I'll start with Dr. Jay Albanese. He is a professor at the L. Douglas Wilder School of Government and Public Affairs, where he teaches criminal justice. Jay served as the chief of the International Center at the National Institute of Justice, the research arm of the U.S. Department of Justice. He is an author and editor of over 20 books and numerous articles on organized crime, corruption, transnational crime, and ethics. Jay's research interests include ethics and the future of crime. Thank you so much, Jay, for being with us here today.
Good to be here.
Thank you. Next, I would like to introduce Dr. Susan Bodnar-Deren. She is an associate professor of the College of Humanities and Sciences, Sociology Department, and co-director of the perinatal mental health research at the Institute of Women's Health at VCU School of Medicine. Susan is a medical sociologist whose research focuses on the life course and social determinants of health and health behaviors and the ways that macro social factors affect individual level health and well-being outcomes. Thank you so much, Susan, for being with us today.
Thank you so much for having me.
All right, we're going to get started with our first question. And it is, more and more people are using the phrase, the new normal, to describe our lives. In what ways will society permanently be changed versus some short-term trends that we might see? And I'll throw it out to either one of you.
All right, well, I'll start because when it comes to speculating about the future, I'm as good as anybody else. It's very interesting. I mean, there's a few things going on, and I'm sure Susan has some thoughts as well. But it seemed to me that even before COVID, there was a trend for people of all ages to go out less. In other words, to go out to lectures less, certainly classes less, concerts, movies, and so forth. And that is streaming and YouTube videos and things like that. We're sort of replacing, live attendance at various events. And I remember asking a class for extra credit, they could go to a lecture on campus of a speaker that I thought was, a fascinating human being. And of course, the most common response I got was, will it be online? In other words, there was no feeling that, I really would like to meet this person. So being captive in your own place for, weeks and months, during the pandemic is likely going to, reinforce that trend, I think. And I'm concerned about people in general being more willing to live their lives online, rather than in person. Experiencing life remotely, has implications for how we understand and assimilate reality. Watching protests on the street is very different from actually being in proximity to what's, physical proximity to what's going on. So I am a little bit concerned about people being satisfied with living and staying at home to experience life rather than going out. And the COVID, I think, is, making that tendency worse.
Thank you. Susan?
Yeah, no, I would definitely, oh, go ahead. I would agree wholeheartedly with Jay. Although I've seen like some little glimmers of some kind of counter movement, and it's anecdotal at best. But when the pandemic first hit and we were initially kind of at this, you know, the stay-at-home order first came out, in my neighborhood here in Richmond, I actually noticed more people walking about the streets and a connection kind of being made on front porches to the people who were passing by that I hadn't seen. You know, you could see foot traffic, but the kind of stopping and saying hi to your neighbor was something I hadn't seen until we kind of began the stay in place. So I think there might be a little bit of some pushback when something's forced upon us, that maybe we kind of are, you know, missing what we once had. But I think on a whole, we've seen, like Jay pointed out, we've seen a trend to people being more socially isolated and, you know, not isolated per se, but not in the physical space, kind of doing their interactions in the digital space. And, you know, one of the things I kind of think in terms of changes from the medical perspective is I also think we're going to see more of a move to telemedicine, teletherapy, and, you know, those kind of online platforms are just going to be part of what our new normal is.
That's great, thank you. I guess sort of as a follow-up to that, you know, there are a number of folks that, as we've been social distancing, we have not been able to visit friends and family, particularly if they have an underlying health condition. Do you think this pandemic will possibly lead us to appreciate friends and family a little bit more, have a little bit more connection in the future, and be a little bit more cognizant about telling someone, for example, I love you, I'm concerned about you, than we ever did before?
Yeah. Well, Jackie, you make a great point. You know, surveys, a lot of surveys report that we value our friends and family more than anything else in life, but our actions never quite live up to that. You know, indeed, you know, issues involving family and friends are, of course, the largest category of excuses we get from our students when they miss assignments. What's happening, you know, it's easy for us to become self-absorbed, especially as everybody has a mobile phone in their hand with the power of a computer, to wrap yourself up in your own devices, you know, chat groups, blogs, your news feeds, all your personal preferences, you know, your playlists, all that. So I'm hopeful that, you know, experience with COVID might ultimately reveal that, hey, we are all either carriers or victims. So our own fate is tied very closely to the conduct of people around us. So, you know, wouldn't it be nice to think of others first, you know, and they're important to us, and how our destinies are very closely linked together.
All right.
Yeah, I totally agree with what, you know, Jay has said. I also think that, and it's kind of piggybacking a little bit on the first question of kind of being now in this online space. We had our students do surveys of their peers and friends and family members as a replacement assignment in one of our courses around kind of how COVID is affecting your life. And one of the things that emerged was that they were connecting with loved ones that they might only see 2 or 3 times a year during the holidays, but they were actually kind of reaching out and talking to them at like weekly Zoom meetings. And so I think maybe, you know, and I study intergenerational relationships, I think maybe to the impact that this has had on institutionalized elderly nursing home residents may, you know, kind of lead to more linking with your grandmother or your great uncle who you aren't going to see that often due to different situations in this virtual space. So I think there's a possibility. And I think that we've kind of, especially how we've kind of looked at older people, I think that there has been a shift to more empathy and more appreciation. Like, wow, I really can't see my grandmother.
Thank you both for those perspectives. So our next question is, how do you think COVID-19 will impact personal and social health hygiene in shared spaces? If we think about teaching and learning and returning for us, returning back to campus, K through 12 education, just some of our normal processes of graduation ceremony, opportunities where we're bringing folks together. How is that going to change over time? Are we going to be able to go back to the way things were, or should we get ready to, I don't know what the future kind of holds in those respects?
Yeah, that's very interesting. You know, face it, we have very little tolerance for people who, you know, sneeze or cough without tissues or handkerchiefs or without covering their noses and mouths. But under the current circumstances of the pandemic, this behavior was previously considered rude. Well, now it's actually threatening behavior. It directly threatens your health. So I think personal experience is the best teacher of all, although it's very inefficient. But now I think thoughtless coughs and sneezing, you know, may become a thing of the past because people are more aware than ever of germ theory, how viruses spread, things like this that most people forgot about after science class in the 9th grade. So I am hopeful that consideration for others might rank higher in, you know, what was formerly the selfish conduct of individuals, where they would, you know, thoughtlessly. Now, if somebody walks into a store, you know, without a mask on, that's considered, you know, inappropriate behavior, and it's not because it's rude; it's because it's disregarding the health of others. And I am hopeful that personal and social hygiene will improve because people will care about others. I'm hoping that people will start looking at others as their reference point rather than just at themselves.
Yeah, no, I was really kind of moved. I was in one of our local natural food stores maybe a week ago, and I did notice actually a big generational difference in terms of mask wearing, right? So people my age and older were wearing masks, and some of the younger kids, you know, were not masked. And I observed actually a peer-to-peer interaction with, you know, kind of one kid kind of saying to this other kid, like, no, man, you have to have your mask on. You kind of have to do this. And, you know, and they did it in a really nice way. It wasn't confrontational, but it was like, you know, you need to kind of check your space. So hopefully, I think that we'll move to kind of being more considerate of one another. But then I think the kind of slippery slope is that when people start to confront over those issues, or for instance, like even, you know, stigmatization of somebody with COPD, right, who's coughing due to a pathology not related to COVID. And, you know, are you going to kind of call people out publicly? So I think there's also just I think we just have to be more conscious of others and the feelings and perspectives of others and the safety of others.
All right, thank you so much, Susan. Jay, I'm going to throw the next question out to you. So COVID-19 has revealed a huge digital divide in this country. And I was shocked to learn that in some communities, libraries don't have broadband infrastructure or Wi-Fi. I thought, you know, if a person didn't have you know, Wi-Fi at home, the one place they would be able to go would be a library. And I have just been floored to learn across the nation that there's many libraries that don't even have broadband. So I guess my question to you is kind of what is the status of broadband and Wi-Fi, and what needs to happen to increase access to all individuals?
Yeah, a very good point. I mean, what makes this pandemic more bearable than any that have gone before it is the ability to communicate with other people from your private space. So you can check on friends and family and loved ones and communicate with them. Fortunately, we all have communication devices of various sorts, but what is crucial is access to the internet. And so the internet gives you news, information, communication with others, which is crucial under conditions that are threatening to people's health. So, you know, to obtain information, the ability to obtain it and to get health and safety alerts and to communicate with others, I would argue will soon become seen as a human right. Right in the US, we consider it a source of corporate profit. We do not see individuals have any right to that. So, you know, phones, computers, tablets, smartwatches, you know, they provide pivotal links to the outside world, and information, which are especially important when we're separated from it. So my question is, isn't it time to ensure that all people have free access to Wi-Fi signals in order to access information and communicate with others, when it's needed? I mean, there are some countries in the world who have done it. Free Wi-Fi access to everyone. All you have to have is a device that can grab a signal. Smartphones are becoming probably the most common device of all. So I think it's time that everybody did. In the US, we still consider access to the internet, it's a corporate service that you either pay for or not. And what that creates is the digital divide that everybody talks about. And to me, it's just very, very difficult to defend, especially in a circumstance like this, where it becomes clear that it divides people rather than access brings people together.
All right, well, thank you. That question was for Jay. Susan, if you have anything you'd like to add. Okay, great. And so what that means, Jay, is that to all of us, we've got work to do. Access to broadband Wi-Fi, we need it, and it's, we're behind the curveball. And so we've got to get a plan together and a strategy to move forward. The next question is also for you, Jay. Given your expertise in the organized crime, looking at the future of crime, I've read where there are phone scammers and other individuals who are taking advantage of consumers and offering bogus cures to COVID-19, trying to sell health insurance, home testing kits, etc., and really just preying on the vulnerabilities of consumers in terms of their virus-related fears. Where do you see things going? What is the status of this right now?
Yeah, I study organized crime quite a bit of the time, and there's been lots of articles and research showing how the conditions of the pandemic are in fact creating circumstances for people to be exploited. And that's clearly true. What bothers me is the kinds of things you mentioned. When I look at a lot of the scams that are occurring, they are not being committed by organized crime groups. They're being committed by regular people who are in fact exploiting others who happen to be vulnerable. And it began early by the selfish conduct. Remember the hoarding of toilet paper, and then there was thefts from vacant buildings. Scams that you talked about. People who would call you and say, "We'll clean the coronavirus out of your house." All these kinds of craziness. Most of these are not conducted by organized crime groups, but by regular people who exploit others for profit. And so there's a sort of an exchange relationship. We tend to be the organized crime that we fear. That is, organized crime provides services to the demand that we create in the regular world. Drugs and stolen property and counterfeit goods and all of that sort of thing. But keep in mind, even in those businesses, organized crime is providing services for the things we want. And as I like to tell my class, in one of our units, I asked, anybody been to New York or other large cities and gone to places where you can get counterfeit bags, all kinds of bags. And of course, shocking number of people have raised their hands, their high school trip, or they went up, and that was their big thing. But what you do when you create a diagram, okay, well, how does that person running that, whether it's a stand or a shop or something, get those bags? All right, well, they get it from a distributor. Where does the distributor get those bags? And ultimately, you could track it back. Most of those bags are manufactured in a developing country, usually in Asia, by people who are working under slave-like conditions, who fit the definition of being trafficked as human beings. So by you buying that counterfeit bag on the street corner of New York, you are in fact helping fund an enterprise that serves to exploit people on the other side of the world. So everything is connected in this life. And I was very hopeful when everybody ultimately got a cell phone, we become more aware, but I'm concerned that people are, as I've said earlier, becoming more internally focused rather than externally focused. But even our innocuous conduct, buying a counterfeit bag on the street corner, actually funds an organized crime enterprise that victimizes others around the world. Everything from the person manufacturing it to the corruption at the border. And when you buy the bag, what is the person doing with that profit? Well, they're not paying university tuition with that money, right? They're funding other organized crime activities to exploit others. So, so small acts result in larger harms, and that's something that I think I work very hard to get that across. There's no such thing as an innocuous act, and I'd also argue there's no such thing as an innocuous attitude, because all of those result in behaviors that cascade. But to finish your initial point about, I'm very concerned when people who have nothing to do with organized crime will exploit others. When I see it sometimes during hurricanes, people from shore areas along the ocean are evacuated inland, and you have some hotel owners who jack up the rates to very high rates. Well, that's exploiting vulnerable people. That's not an ethical way to live, but that just shows how otherwise law-abiding people sometimes behave very badly in times of crisis.
Oh, thank you, Jay. Thank you for raising our awareness, and we all just need to recognize that we need to be more cognizant and have those thoughts in the forefront of our mind, because yes, we will go shopping and get that bag and not think about the implications of that long term. So thank you for that. Susan, I'm going to jump over to you now. People are being asked, to self-quarantine for 14 days, if they have or suspect they have COVID-19. And I guess, what are some of the long-term risks of social isolation?
Yeah, it's a great question. And I think that the risks are very dependent, kind of actually like the virus itself, dependent on kind of pre-existing conditions, right? So obviously for somebody to socially isolate, especially if they're in like a quarantine situation, if there's like an underlying history of depression or anxiety, that may manifest itself very differently than somebody who doesn't have that pre-existing condition or, risk of, depression, anxiety, or other types of mental disorders. I also think self-quarantining is going to look very different based on your pre-existing social context, right? So if you're self-quarantining in a room in your house and you've got family members around who can bring you, your dinner and your lunch and can kind of talk to you through the door and kind of, you can still interact to a certain extent, that's not going to be as problematic, say, for somebody who is self-quarantining in a completely isolated space, right? Where they don't have any chance to have interactions with one another. And so I see a couple of my former students in the FACE group portion of this, and they know that social interaction and social support are protective for not only our physical health, but for our mental health as well. And so I think, this is a long way of saying that just like with how the virus is playing out epidemiologically in terms of kind of the biophysical, we really need to be incredibly cognizant of individual pre-existing spaces in the context in which we are located. I think this is where race can play a big part of this. Social class plays a huge part of this. If you're socially isolated and self-quarantining in a food desert, or a neighborhood that doesn't have access to delivery services and things like that, it's going to play out very, very differently than if you're socially isolating or quarantine in a place where, Grubhub is coming, you can hear voices on the street, you can get some of those needed supplies for survival. So I think it really depends on the context.
Okay, thank you, Susan. And I guess a follow-up to that, this is a very stressful situation with the virus, etc. Do you see it, could we classify this as that some individuals might have post-traumatic stress as a result of the pandemic in some way?
It's a really good question. And, I know that we saw these questions a little bit beforehand. As far as like actual PTSD and, a DSM-5 diagnosis, again, I think it's going to be really dependent on where people were pre-COVID. And then how COVID plays out, right? So I do think it depends on how it really hit you. I think the risk for, say, post-traumatic stress disorder just based on social isolation may be somewhat low. But if you lost a loved one and you couldn't see that loved one in the hospital, you couldn't, I think about places like New York City at the height of the pandemic, then there's definitely an increased risk for PTSD. I think those who are on the front line are incredibly at heightened risk for PTSD, especially in the early stages of the pandemic in those hot spots, New York, New Jersey, New Orleans. And so again, I think your social context, and that's why in health, we always kind of talk about, we don't just talk about the physical health, we just don't talk about the psychological health, we talk about the biopsychosocial, that all of this stuff is so intertwined with one another that we have to consider context when we're looking at outcomes. I know, this is anecdotal, but my daughter is an ICU nurse and has been a trauma nurse for a while. And she was at the facility that she was working at, she was heading up the kind of nursing unit in terms of, they converted the regular ICU into the COVID ICU. And she's somebody who deals with death every day, quite frankly. But most of the folks in ICU are older people. And most of the folks in ICU have loved ones who can come in and, experience what we call a good death, or as close as we can do this. And she was coming home. First, there was a lack of PPE early on. She was using the same mask for over a week. She didn't have a shield. All of this stuff wasn't occurring. The tests that they were administering to patients on the unit, they'd have to administer 2 or 3 different types of tests. They were waiting 7 to 10 days to get results. So, they didn't know. And so that was stressful. Like she was coming home, really kind of freaked out. But the thing that sparked me the most is when she talked about people dying alone. And, you're the one holding their hand. And then she talked about kind of these off-time deaths that in her unit, she had a 21-year-old young woman who came in, no pre-existing conditions, had the virus. It escalates very quickly, went into arrest and couldn't reach out to people, and how that traumatized her in terms of this isn't our typical patient and we don't have the resources to deal with it. So I do think that depending on where you are in terms of your social context is going to really dictate how vulnerable you are in terms of this manifesting itself into kind of PTSD.
And thank you so much for that context. And I think another area is that how the pandemic is affecting Black and Brown people, people of color. It is really revealing the disparities that we already knew, but I think it has increased our awareness to a heightened level at this point. I don't know if there's anything else to add to that, but I think I wanted just to make sure that we kind of touch on that as well.
Yeah, again, absolutely. Context. Yeah, one thing to add to that, because that's a crucial point, especially for whether you're young or old, in the last few weeks, we've experienced something that hasn't been experienced for 100 years. You have a pandemic, right? That has killed more people than anything since the flu pandemic of over 100 years ago. That has disproportionately seen minority populations suffer, right? Because they're at higher risk. Why are they at higher risk? Well, they have higher incidence of heart disease, diabetes, and so forth. Well, why? Well, there's the disparities in healthcare. So we have that issue. Then the second issue, strike two, I would call it, is the economic circumstances is the worst it's been in 100 years. 40 million people unemployed. Depending on which economist you listen to, that's one out of every 4 or so people is out of work in the United States. That's the worst it's ever been since the Great Depression. All right, that is differentially experienced by people, especially minority populations, because people in different lines of work are experience it differently. Then strike one is the pandemic, strike two is the economy, and strike three is the reason for the protest in the streets we've seen over the past 10 days. And that is, underlying this is something that has been a problem for quite a while, but now with the advent of videos on phones, America is seeing it. And the current crisis, and it's clear that the disproportionate and discriminatory treatment of minority populations, specifically African Americans, in the criminal justice system is an ongoing issue, and it has been for quite a while. So you want to make sure that whether you're a white person or in a minority, whatever you are, you're experiencing stress you've never experienced before. People in the last several generations have not experienced this combination of stress at once. We're facing the criminal justice system is not working as it should. The economy is tanking. The pandemic is threatening large numbers of people. Over 100,000 deaths, the equivalent of our last several wars combined. So on the one hand, you can throw your arms up in despair and say, well, this is just overwhelming. But on the other hand, you have to look at it for an opportunity. This is an opportunity to create change. And no matter, who you are, and no matter what your status is in life, or whether you're very young or very old, this is a time to actually pursue change, because we're talking about health, economics, and equality before the law. And it's hard to think of three things that are more important in society.
Yeah. And I think in terms of trauma, to add on kind of what Jay was saying, it's like the economic kind of perspective of it and how that is intertwined with race and ethnicity is, on one hand, you have heightened rates of unemployment. On the other hand, you have, Black and Brown Americans are the ones disproportionately who are on the front line at grocery stores and in the service industry who have to, right? They're the essential workers who have to be there, who are constantly putting themselves in harm's way. And it's one of the reasons, right? We see disproportionate rates of the virus in Black and Brown communities. And I think there's this kind of notion of crisis overload, right? We can only physiologically deal with so much stress. And I think even before COVID happened, your stress levels based upon your social positionality were completely different, with racialized minorities and low SES folks really bearing stress levels, the science that kind of takes cortisol levels as markers of stress physically in individuals show that there's a huge biophysical difference based on the external context of the stressful places that you live. And so I think that there is this kind of collected trauma that was pre-existing even before COVID, and COVID exposed it. Those of us who do health disparities work, none of this really was surprising. I think what is that this is kind of out as part of the national, dialogue and language, right? The fact that people talk about health disparities on the news now, it's like, well, yeah, no, we've been studying health disparities really markedly for over a quarter century. And I was really, I actually put this to my students in my medical sociology class once we went online. There was a press conference actually where Dr. Fauci came out and, basically did say like, well, yeah, we've known that this was disproportionately going to affect Black and Brown people. And he basically said, but we're in the middle of a pandemic, and now is not the time to kind of concentrate on that. And it was like, well, if now's not the time, when is the time? And so I think that there's just this collective trauma of racism, of exclusion, of, limits on economic well-being and housing that is coming together to put people who are already vulnerable in these vulnerable spaces. And then, again, like Jay said, there's always opportunity when there are challenges. And I think that, maybe we're seeing people here in the state of Virginia, in the nation, kind of rise to these challenges, because the protests that are happening now, yes, they are about police violence, but they're also about 401 years of systematic oppression that we see manifested in our health disparities, that we see, we could be talking about education just as easily as we could be talking about health right now. Across all of our social institutions, we see this manifestation that really, people have been traumatized for centuries, but COVID has shed this light on it, like, oh gosh, wow, this is really happening. And so I think that's the opportunity. The opportunity is action, because we see things, not only on our video phones, but also in terms of the data that are coming out. But the data's always been there.
All right, thank you both for that perspective. It is definitely a call to action, and if what's happening across the country and the nation, the world, people are coming together and raising awareness more than ever before. I think it's not just a moment in time, but a movement, and this is our opportunity to get it right. Going back to you, Susan, you mentioned Dr. Fauci. Can you give us a little bit of background on the National Office of Pandemic Prevention and kind of some of the shifts and what has happened with that office and the CDC, the World Health Organization, and so forth?
Yeah, gosh, this is like something that I cannot answer in a very clear and concise way, because it's confusing. It's actually confusing to really get the factual information, to be honest with you. So we've actually always had kind of a office. It's had different names historically with regards to pandemic response. And, there's been, I think this National Office of Pandemic Prevention has been one of these places where there's been so much misinformation kind of put out on social media and in the news. I know, like, the Washington Post itself has printed contradictory statements that have consistently had to be fact checked. But more in the kind of recent space, during the Obama administration and really the Ebola crisis, or the Ebola pandemic, this office was formulated in response to the United States assisting in a global response to Ebola. And, if you can remember back to Ebola, we had cases here. People came back here and we really did quite well. And the office was in existence when the current president took over, and however was reorganized a number of times, where a lot of key personnel were let go, including many epidemiologists. There was also an office of this department in China that actually was almost completely disbanded, going from a couple hundred people to just, a little over a dozen, which is critical in this case because, we seem to kind of ideologically know this. So there was a lot of gutting under the auspices of streamlining, which kind of coincided with what many in the epidemiological community see as an attack of science and evidence, more broadly. With regards to trust in the CDC and the WHO and Johns Hopkins, again, I see a couple of students who were in my graduate course this past spring, and we started talking about the pandemic day one in class, actually. Even before, the president had his, received some of his memos, we knew this was out there. The WHO was, there was alarms. The CDC was raising some alarms. And I've been doing health research for a while. And it was funny because I've always put my trust in CDC. CDC data is solid from my perspective. I do research on suicide and suicidality. And I mean, that's where you get, all of your data, that it's been vetted. What we started to see though, is that no organization is apolitical. And, as my students started kind of deconstructing some of the messaging that was coming out of the CDC and the WHO, it became really clear that early on that there was definitely politics behind what was going out. Because information is political and it is weaponized actually in 2020. And so I think from a purely scientific perspective, we started really shifting to looking at Hopkins data. And if you're, a critical consumer of news, you'll actually see that many of the reporting agencies moved from reporting CDC numbers to moving to Hopkins numbers because they were seen as being somewhat less political than the national organizations, right? Now, with that being said, I don't want to diss on the CDC. The CDC, there are amazing scientists at the CDC. I think some of the issues were people, the research is going on. They are doing amazing work, but it is, things get filtered in this political moment. And so there does seem to be there's mistrust, number one, but there does seem to be some reason for that mistrust. I think that was early in the pandemic. I think the severity and the implications are well established, and we've seen, kind of almost back to a new normal in terms of, where the data is coming from. But I think when we think about the data, I think race becomes another real interesting issue, right? The non-collecting or the non-reporting of race data. On death certificates, race data is there, it's a field. So when you have 90% of your death certificates not reporting race, that should be a little bit of a flag. We've done it historically for really nefarious reasons. And we do it in the contemporary space to really track disparities. And so that's always, you even kind of think of something like a death certificate as a death certificate, but that's a political piece of paper. How cause of death is coded, it, says something. And I think of George Floyd's autopsies, right? The official Hennepin County autopsy talked about extenuating circumstances and underlying conditions when the two independent autopsies reported just the opposite, right? Again, students in my class, we do a project where we go through publicly available death certificates because they're publicly available. And we look at cause of death over the 20th century of individuals who were buried in the East End Cemetery. And some of my students will do comparative analyses with people in Hollywood Cemetery or Oakwood Cemetery, primarily white cemeteries. And we found, again, small n, just a couple hundred, but looking at how death by a kind of liver failure was coded. For African-American dissidents over the middle of the 20th century, the coroner would list alcoholism. Like that was the cause of death, compared to a non-Hispanic white person who dies of cirrhosis of the liver, dying of cirrhosis of the liver. And those labels say two very different things about who these people are. And that was political at the time, right? That was a reflection of the Jim Crow racism and the exclusion. And so, I think, epidemiologists are talking about this kind of going forward, that we think our cases, that there's an undercount, that there most certainly will be more cases that come in, how deaths were coded, especially early on. And there was political impetus to make this go away, to make it seem like it wasn't as bad as it was. And it brings to mind the heat wave at the end of the 20th century in Chicago, that over a 10-day period, a few thousand people died of a heat wave. And the people who died, it wasn't randomly distributed across the city of Chicago. It was people who were socially isolated, the elderly, those who lived in Black communities. So South Side of Chicago was disproportionately affected. But the city, in reporting the deaths, instead of reporting it as heat-related death, would just report the underlying conditions. And these folks, this was what we call excess death, and these folks certainly died of the heat wave, right? And Eric Kleinman did a really great book called Heat Wave. I think it was published in 2004, and it was a social autopsy of the Chicago heat wave. And I expect that when all of this kind of moves to the next stage, we will need to do social autopsies. What were the underlying situations? How was this, how was mortality and morbidity distributed? And a big part of it is the public response. Who gets to control the message and how these things are being reported. So I think the data coming from these large organizations, I think it's solid. It's what we have to go by. These are our experts. But I also think we need to be a little bit critical when we kind of consider sources.
Thank you so much, Susan, for raising our awareness in that perspective. I do want to, we have a few minutes left. I do want to encourage folks to post questions to the chat. And we do have one question right now from Rick H. Rick's question is, do you think that we will need to relearn how to treat each other once we can limit the physical distance between us? Is this an opportunity to create a culture change?
That's a really, really good question. To tell him he can sign up for classes in the fall. No, that's a very, very insightful question, just in as much as are people primarily self-interested, self-seeking people, and how does that compare to the extent to which we are concerned about the welfare of others? And is this going to make that divide better or worse? I see that as an ethical question. I teach a course in ethics, and I go on about this at length, but the bottom line is, we all get tied up with all the noise of life, but because it fills our lives. I mean, just think of all the things that we do. We have appointments, we go to work, we play, we pay bills, we commute, we never quite keep up with our social commitments, all of these things. We have all this stuff becomes our life, but we forget, well, what really gives your life meaning? And it seems to me the only thing that gives your life meaning is that, your life really has meaning to the extent that you're living for others. The extent to which you're living only for yourself, that's an unsatisfying life that will be quickly forgotten once you're gone. So in both your personal and professional life, if people can self-assess, and I'm very hopeful that this is an outcome of the pandemic. I'm hopeful rather than optimistic, but because a little training in ethics, you can learn ethics like you learn anything else, like research methods. It's a skill, and to recognize an ethical dilemma when you see one, and many people do not do that. But if people engage in that self-examination and say, well, yeah, I want a life that has meaning. Well, what gives your life meaning is focusing on other people. So when I see people observing social distancing out in public, I say, see, they're showing consideration for others. When I see people wearing a mask when they go in the store, that's showing consideration for others. So that's other-oriented behavior, and that's the kind of things I think we should be looking for, whereas my self-interest should always be secondary to the interest of those around me.
Thank you, Jay. I don't believe we have any other questions in the chat. So I want to thank both Susan and Jay for your insightful perspective this afternoon. Hopefully we will be able to continue the conversation for our students who are out there and others. I mean, there are so many research opportunities in terms of undergraduate research, graduate research, and so forth for us to take up this challenge. And even as we think about you know, the census, for example, the elections coming up, there is so much work for us to do. So I just encourage everyone to find their passion, that important issue to them, and just become active and make a difference in our communities. Thank you so much, everyone. And thank you to our audience.